Hi, my name is Dr. Matt Antonucci from the Carrick Institute. We're going to be talking a little bit more about the Functional Neurology Management of Concussion course. Specifically, we've been talking a lot about phenotyping and the different phenotypes of concussion. I propose that we introduce a phenotype of autonomic dysfunction to concussion. And what I'd like to talk a little bit about is how do we assess that autonomic phenotype? So when we start looking at the autonomic phenotype, there's a bunch of testing that we can do to assess somebody's autonomic integrity, looking at heart rate, blood pressure, and more importantly, how those respond to both cognitive tasks and changes in position. So these are often affected by concussion. So some of the simple things that you can do in practice is perform vital assessments in a seated, supine, and standing position. And there's some research on this, pretty strong research around it as well too. And wouldn't it be nice to also know before your patients or your clients arrive at your office if they're going to have autonomic dysfunction? So something called the Compass 31 has been created that actually does a really good job assessing the different domains of autonomic dysfunction and can actually tell you, predict almost if somebody has autonomic issues. So the 8 different domains that the Compass 31 covers are vasomotor function, orthostatic intolerance, pupil function, gastrointestinal, also secretomotor, like things like sweat glands, tearing, parotid glands, things of that function, bladder function, sexual function, and sleep. And these were all developed off a much larger autonomic symptom profile that took a long time to complete. This one takes minutes and actually works really well. As a matter of fact, if you want to try it for yourself, you can download the form or actually try taking a survey that will give you a Compass 31 score. And as far as the scores for the Compass 31, what's good and not good, a Compass 31 of greater than or equal to 12 is more than 3 standard deviations above normal. And greater than 30 predicts moderate to severe autonomic dysfunction. So if an individual has sustained a concussion and they call your office up and say, hey, I'm having some issues, you can send over this Compass 31 assessment to them immediately, have them fill it out, and you'll be able to understand if they have autonomic symptoms. Greater than 30, I would suggest referring them or at least co-managing them with somebody. But if you see that they have between 12 and 30, it might be somebody that you can expect to have autonomic dysfunction, someone that you can help through some of the strategies that we're going to teach in the Functional Neurology Management of Concussion with the Carrick Institute. For more information, check out carrickinstitute.com, register for the class, and enjoy all of the information that we're going to be sharing with you over the next couple months in this program. It was a joy to put together, and I know you're going to absolutely love it. And know who's going to love it even more? Your patients. Thanks so much, and we'll see you next time.